facility, according to the residents, was constructed 5 years ago in response to an increase in maternal-related cases in the community. It was, however, commissioned and operationalized without any provision for basic water and sanitation services. There is also no accommodation facility for the midwifery staff. At the facility, the only basic water and sanitation materials were a small-sized tank, 2 old Veronica buckets, and a mini waste bin, all said to have been provided by well-intended organizations. One of the organizations is currently building an incinerator for the facility. Part of its main entrance was closed with 2 padlocks, an indication of low patronage. Also, the facility lacks beds and basic supplies and no physical space, as the staff sitting room also serves as both the consulting and operating wards, with just a bed for all categories of patients. Ayamga Francis is in charge of the facility.
At times, hand hygiene, if there's no water, can you wash your hands before any of the procedure? If we access to bath and start the daily work, there is no water. You can see that we are relying on these pollutants. Dry season, we use all this water and we don't have water too. So dry season, we have to go to the black water there to fetch water. Even that water is not safe for us.
As a result of the situation, a midwife who was posted to the facility 2 years ago is yet to accept her posting and resume work. The in charge said the facility can only function effectively with the provision of water and staff accommodation.
We have a midwife posted, but he has not yet come. Almost 2 years now. One major issue is that when the midwife comes, all her procedures need water. I get it. And when you come and see that we don't have water, then they have to repost her to some places.
Residents of the community who were happy in 2016 when the facility was commissioned said nothing has changed and that getting quality health care still remains a challenge. They disclose women still resort to local traditional birth attendants. Dahamani Azuma, who has assisted in the delivery of many women in the community, is also worried. Our facility has no midwife due to the lack of water situation here. Women travel to Nasia and Walewale to deliver. We are pleading for a midwife and a clean drinking water. The lack of safe drinking water in the community of over 1,000 residents is not only affecting healthcare services but education as well. The residents source water directly from the Black Volta River, known in the area as Nasia River. According to them, several school children have drowned in the river as they tried fetching water for their school activities.
Even because of the water situation here, we don't have a midwife, because when there's a drilling operation is going on, there must be water, and if there's no water, then it becomes a problem. And then that same thing happens to the school. Despite of the rainy season, when it comes to dry season, the children, they wake up early in the morning, go to the river, fetch water before they go to school. And after closing, they will go back to the river again, fetch water before they go back to extra classes. So we are appealing that our water situation, the whole world should hear our voice, including the current government and his voice, that the Daboya people are crying for water.
Elias Sutanko reporting.